Hello, good afternoon everyone. For today's topic, I am going to tackle lesson 4. It's about manicure and pedicure services. When we talk about manicure and pedicure, we're talking about nails. Note that nails are part of the integumentary system, which also includes skin and hair. The root of the word pedicure is two-part. Pedi from ped meaning foot and cure from curare meaning to care for. Similarly, manicure comes from manus meaning hand and curare. From the roots, you can see the critical difference between manicure and pedicure. Manicures are hand care and pedicures are foot care. The fingernails are very important structures made of keratin. They act as protective plates and enhance the sensation of the fingertips. The protection function of the fingernails are commonly known, but the sensation functions are equally important. The fingertip has many nerve endings in it, allowing you to receive volumes of information about objects you touch. The nail acts as counterforce to the fingertip, providing even more sensory input when an object is touched. Nail growth. Nails grow all the time, but their rate of growth slows down with age and poor circulation. Fingernails grow at an average rate of 3.47 millimeters per month, or about a tenth of a millimeter per day. If you happen to lose a fingernail, it may take up to 6 months for that nail to completely grow back. Toenails grow much slower than fingernails. They grow at an average rate of 1.62 millimeters per month, and if you lose a toenail, it can take up to a year and a half for it to completely grow back naturally. The nail structure. Each of these nail structures has a specific function, and if disrupted, can result in an abnormal appearing fingernail. 1. Matrix or the germinal matrix. This is the most important structure within the nail unit. We can find it beneath the skin, behind the fingernail, and extends the several millimeters into the finger. 2. Nail bed. This is a part of the nail matrix called the sterile matrix. The nail bed is the pinkish-colored soft tissue underneath your nail plate. It contains the blood vessels, nerves, and melanocytes or melanin-producing cells. 3. Nail plate, corpus unguis. This is the hard part of the nail made of translucent keratin protein. The underneath surface of the nail plate has grooves along the length of the nail that help anchor it to the nail bed. 4. Cuticle or cuticula. This is also called the eponychium. It is a layer of clear skin located along the bottom edge of the finger or toe. This area is known as the nail bed. The cuticle function is to protect new nails from bacteria when they grow out from the nail root. 5. Hyponychium. It is the skin just under the free edge of your nail. This is the area between the nail plate and the fingertip. The hyponychium stops external substances from getting under your nail. This can make it painful to trim your nails. 6. Nail root. This is the part of the nail located in the sinus, especially at the base of the nail, embedded below the skin. 7. Nail lunula. This is the crescent-shaped area at the base of the nail plate and is usually pale white to light pink in color. It is the extension of matrix and is most evident on the thumb. Lunulae cover the bottom of your nail just above your cuticles. 8. Free edge. A soft tissue seal underneath the extended free edge of the nail plate whose purpose is to prevent pathogens from infecting the nail bed. This is the end portion of the nail plate that reaches over the fingertip. 9. Nail grooves. These are slits or tracks on the sides of the nail upon which the nail moves as it grows. The underside of the nail plate has grooves that run along the length of the nail and help anchor it into the nail bed. 10. Nail walls or the proximal fold. The nail wall, also known as the vallum inguis, is the cutaneous fold overlapping the sides of the proximal end of the nail, or simply a fold of hard skin overlapping the base and sides of a fingernail or a toenail. Toenail disorder and diseases. Nail disorder is a condition caused by injury or disease of toenail unit. Nails are susceptible to many of the conditions that affect skin and are prone to a number of unique conditions. 1. Bruised nail. The doctor may call it subungual hematoma if you have bleeding under a fingernail or toenail. It usually happens if the nail gets crushed in an injury. There may be need to refer to a medical practitioner. Nail technician should give gentle manicure and pedicure. 2. Discolored nail. This is a condition in which the nails turn a variety of colors including yellow, blue, blue-gray, green, red, and purple. This can be also a sign of disease and should see a dermatologist. Meanwhile, application of nail polish can hide this condition. 3. Hangnail. This is a piece of torn skin at the root of a fingernail. It is caused by dry cuticles that have been cut too close to the nail. Many people experience hangnails when their skin is dry. This can also be caused by trauma such as a paper cut or excessive finger picking. A person who has this should give gentle manicure with emphasis on cuticle work. Tips to prevent hangnails. A. Keep the skin around the nail well moisturized by regularly massaging with cream. B. Avoid repeated washing of hands as it causes dryness of skin. 4. Leukonychia, also known as white nails. This describes a whitish discoloration of the nail which may be due to persistence of nuclei in the cells of the ventral nail plate or to a pallor of the nail bed. The most common cause of leukonychia is injury to the nail bed. 5. Onychotrophia or atrophy of the nail. This describes as the wasting away of the nail. The nail loses its shine, shrinks, and falls off. It can be caused due to the damages of the nail matrix or due to injury. Then internal diseases can also cause onychotrophia. 6. Onychosis or hypertrophy. This is a nail disorder that causes fingernails or toenails to grow abnormally thick. Over time, the nails may become curled and turn white or yellow. Its treatment is to trim to bring the nails down to size, but if the nails are ingrown, it is advisable to ask a doctor for assistance. 7. Onychocryptosis or ingrown nails. This is a fairly frequent problem resulting from either growth of nail fold inwards into the nail bed or abnormal embedding of the nail plate into the nail groove, causing significant discomfort. Tips to prevent ingrown. A. Trim your toenails in a straight line across. Do not curve your nails while trimming. B. Do not trim your toenails too short. C. Wear shoes that fit you properly, both in length and width. 8. Eggshell nail, also called as hapalonychia. This causes your nails to be soft and thin. Nails affected by this condition tend to bend or break more easily than healthy nails and often split or flake at the end. One should be careful when manicuring these nails because they are fragile and can break easily. 9. Onychorexis. Your nails may have several splits that cause triangle tears on the edges by injury to the finger or exposure to harsh chemicals. You may give oil manicures to improve the condition. 10. Onychophagy, or simply known as nail biting. This is an oral compulsive habit of biting one's fingernails or in some cases the toes. People who suffer this disorder are not aware that they are not biting their nails until they feel pain and notice that nails become deformed. 11. Pterygium. This is the common condition of the forward growth of the cuticle on the nail. The cuticle sticks to the nail plate and, if not treated, will grow over the nail to the free edge. Severus says treatment for pterygium begins with topical steroids in the form of creams and lotions or anti-inflammatory medications. 12. Furrows or corrugations. These are transverse lines or grooves across the fingernails. This condition may be caused by local disease of the nail fold. If low levels of minerals or vitamins are to blame, you may be advised to alter your diet or take supplements to boost your levels. 13. Nevus. This is a stain on the nail caused by a pigmented mole that occurs in the nail. The color of the stain is usually brown or black, and so application of colored nail polish can hide this disorder. 14. Paronychia or nail infection. This usually results from bacteria, fungi, and viruses. The bacteria gets into the skin through cuts in the cuticle and the nail fold, that is the skin around the nail. Paronychia doesn't usually cause serious health problems. People who have their hands in water for extended periods may develop this condition, so be cautious as it is contagious. 15. Pseudomonas or Pseudomonas aeruginosa. This is a bacterial infection. Patients likely have a history of prolonged exposure to water and detergents. The darker the color of the nail plate, the deeper into the nail plate the infection has spread to. However, this can be treated with brushing of the nail bed with 2% sodium hypochlorite solution twice daily. 16. Onychomycosis. This is caused by various organisms like damage to the foot or if a person has had athlete's foot prior to the development of onychomycosis. It is very difficult to treat, so this must be seen by a doctor or a podiatrist for this not to be worsened. 17. Onychotrophia. Describes the wasting away of the nail loses its shine, shrinks, and falls off. It may be caused by injury or disease to the nameplate. Unfortunately, onychotrophia is often an indicator of a far worse underlying illness. The reason for this is not in the nails. Onychotrophia can't be treated in an isolation. This can be hidden by painting your nails with nail polish. 18. Vertical ridges. This is where the nail plate grows forward onto the nail bed in a rail and groove effect. Slight vertical ridges commonly develop in other adults. Nails can be strengthened by taking biotin vitamin supplements, by wearing gloves for all wet work, and by frequently applying moisturizing cream to the nails. 19. Hematoma. This is the result of trauma to the nail. An ill-fitting shoe is a common cause of this. The nail bed may bleed as a result of trauma. The blood is then trapped between the nail bed and the nail plate. In some cases, the nail plate may have to be removed if not treated properly. Ice and elevate the area to reduce swelling and take over-the-counter anti-inflammatories. 20. Fungal infections. Fungal nail infections are common infections of the fingernails or toenails that can cause the nail to become discolored, thick, and more likely to crack and break. They can spread from toenail to toenail. Fungi infections grow in moist, warm, and dark environments. This must be treated internally. Tips to prevent fungal nail infections. Trim your nails short. Keep your nails clean and dry. Absorbent socks should be worn. Change them often if your feet sweat excessively. Do not go barefoot in showers or in public places. Antifungal foot powders can be used. 21. Brittle nails or splitting nails. These are common nail problems. The usual cause is an external factor. It may be due to repeated wetting and drying of fingernails. If the toenails are not affected, the primary cause is typically environmental. Two types of brittle nails. 1. Dry and brittle nails are the result of too little moisture, characterized by dry and flaking nails. People with dry skin and elderly people are more prone to this condition. 2. Soft and brittle nails are caused by too much moisture, often a result of overexposure to detergents, household cleaners, and nail polish remover. Tips to prevent brittle nails. A. Using a lotion will protect your nails from excessive dryness. B. Wearing gloves when performing household chores to prevent your nails wet frequently. C. Be gentle to your nails while filing and round the tips in a gentle curve. D. Do not remove your nail polish too frequently to avoid the harmful effects of nail polish remover as it contains acetone. This way, nail care is a vital thing to maintain a healthy body. So always once a week get the treatments for ensuring the great look of nails and clean them regularly for keeping them strong and hygienic. Thank you for listening. Have a great day.